everyone and welcome back to our channel, episode 11 Phobia. I'm Riya Rathi, counseling psychologist at TalktoAngel, and today we have Dr. R.K. Suri sir, clinical psychologist at Psycho Wellness Center with us. Hello sir. So a lot of us get confused about the terms phobia and fear. We think that it's synonymous. And while we all know that both these terms necessarily don't mean the same. So how do we differentiate fear and phobia?
Let's first understand what do we understand by the term phobia. Phobia is a irrational, persistent fear which is out of proportion. It means it is an extension of fear to a great extent. It is overwhelming to an individual because it's continuing for a longer time. That's why we call it persistent. And whereas the fear is a natural human emotional response to any of the event. For example, somebody comes all of a sudden in front of me while driving a car and I'm not able to judge it. I will be having a fear of having an accident. But that is not phobia. Phobia is a persistent, consistent response which is becoming overwhelming. The fear and phobia could be differentiated on account of four major parameters. First is the intensity, second is rationality, third is duration, and fourth one is the criticality. Now, if the intensity is less, it is fear. If the intensity is excessive, then it may be culminated into the phobia. Now, duration of fear is momentary. It goes away when the events goes off. But in case of the phobias, it becomes persistent and continuous for longer period. When it comes to the criticality, the phobia is more critical with reference to treatment modality as well as in terms of making the person overwhelmed. Fear is less intense, less critical. So these are the major differentiator in terms of the understanding.
Rightly said, sir. So how are phobias developed? Is there a genetic factor or is it some sort of learned behavior?
When we talk about the issue with reference to that a fear or a phobia, is it genetically loaded? To some extent, we take into consideration that it is having both combination of genetical as well as the behavioral component or learned component. Now, those are the irrational, persistent fears which are overwhelming. Now, there could be a genetic loading, but invariably it is a learned response or learned behavior.
Can a person's fear turn into phobia? And if so, how does it happen?
As I mentioned that it is a persistent. If I am able to identify a fear and able to handle the fear in a more meaningful manner, which is an emotional response. And we often say that the response to any incident or event are fear, flight, and fight. Now, if my fear becomes persistent, irrational, out of proportion, then it is difficult to give it up so easily. It requires a help by a professional to identify the reasons of phobia, and the etiology of phobia is very important to understand. Means the cause and effect of the phobia.
That's very informative, sir. There are different types of phobias, and how can we treat them and manage them effectively?
The most common fear are being called as a normal response to any kind of, say, avoiding a school is a fear. My friends are going to taunt me is a social fear or social anxiety. Now, fear may lead into an anxiety, and when the anxiety is becoming more prominent, it may culminate into phobia, and many times phobia may culminate into obsessive compulsive behavior. And if it so happen, then it becomes important to treat it by using cognitive behavior therapy or the behavior modification or the counseling, as well as many times for phobia we often use the anxiolytic medication which are being prescribed by a psychiatrist.
So, sir, what are the recent advancements in the management of phobias?
Thank you very much. This is a very pertinent question which needs a thorough explanation. As far as the phobia is concerned, nowadays a lot of emphasis is being given using the technology along with counseling. So we are also making at TalktoAngel, we are also making an effort in terms of bringing in the AR, VR, virtual reality, and the augmented reality with reference to identification of phobias like the fear of snake, phobia of snake, lizards, etc. And then treatment of the same using the virtual reality practices, which are going to be a sea change in the years to come. So virtual reality, it would be a very important part and a part of the treatment modality. For example, one is having a phobia of entering into a lift, claustrophobia. For this, VR is going to be a very important technique and tool. Similarly, the phobia for excessive machine uses, traveling in the flights, etc. So one can simulate the situation using the virtual reality, which is the key thing. And a lot of new innovations are being carried out by Google also on those lines. So currently the cost is a barrier, but I personally feel that with the research has been carried out by TalktoAngel and other platforms and other organizations, we will be getting a good breakthrough in terms of better management of phobia as well as the obsessive compulsive disorder. I would suggest that if you or any one of your family member is having an issues with reference to fears, phobias, or obsessive compulsive behavior on account of the fear, I would request please reach out to the best clinical psychologists and psychologists at our platform.
Thank you so much, sir, for such an informative session.
Thank you very much.
See you in the next episode.